Have you ever been in an intimate moment, felt the orgasm, but nothing came out? Or maybe you've noticed the amount you ejaculate is much less than before. If this has happened to you, you've probably wondered if it's normal or something to worry about. The truth is, you're not alone. There are very clear medical explanations for what's going on. Today we're going to break down this mystery that affects millions of men around the world, but very few dare to talk about. The subject may sound taboo, but it's far more common than you think. From men in their 20s to those in later years, many experience what's medically called dry ejaculation or anejaculation. Sometimes it's temporary and reversible. Times it can be a sign that something deeper is happening in your body. What matters is that you understand the causes, know when it's normal, and know when it's time to seek medical help. Over the next few minutes, we'll explore the 5 main causes of this condition. We'll talk about practical solutions, available treatments, and most importantly, when to see a specialist. By the end of this video, you'll have a clear understanding of what might be happening in your body and know exactly what steps to take. Before we continue, an important note: this video is for educational purposes only and does not replace medical advice. If you experience any of the symptoms we describe, please consult a urologist or another qualified specialist to get an accurate diagnosis and the right treatment for your case. Normal ejaculation. In a typical ejaculation, your body releases between 2 and 5 milliliters of semen, a fluid containing sperm and secretions from several reproductive glands. This process is coordinated by your nervous system, which synchronizes contractions in multiple organs: the testicles, seminal ducts, prostate, seminal vesicles, urethra. When something disrupts this chain of events, the result can be what we call dry ejaculation. You feel the orgasm, but no semen comes out. The amount is very low. It's important to understand that an orgasm without ejaculation doesn't always mean something serious. But it does mean that one part of this complex system isn't working as it should. Because wanting retrograde ejaculation, this explains about 60% of all cases of dry ejaculation. Semen doesn't disappear. It just takes the wrong route. Instead of being expelled outward through the urethra, it flows backward into the bladder. Think of it like a traffic light at an intersection. Normally, the light directs traffic in the right direction. But if the light fails, go the wrong way. That's what happens with retrograde ejaculation. The bladder neck muscle doesn't close properly, so semen goes into the bladder instead of out. Later, expelled when you urinate. Common causes include prostate medications, like tamsulosin, certain antidepressants, high blood pressure drugs, diabetes affecting nervous, prostate surgery, spinal cord injury. Sometimes it's reversible by adjusting medications. But when caused by surgery, usually permanent. Cause 2A, blockages in the seminal vesicles or ejaculatory ducts. The seminal vesicles, 2 walnut-sized glands behind the prostate, produce about 70% of semen volume. If they become blocked by infection, cysts, or scar tissue, semen production or transport is disrupted. Symptoms may include gradual reduction in semen volume, pelvic pain during or after ejaculation, thick or unusual looking semen, pain with bowel movements. The good news: many of these blockages can be treated with minimally invasive procedures. Cause 3. Hormonal imbalances. Low testosterone. Testosterone isn't only about sex drive and erections. It's also crucial for semen production. When levels drop significantly, hypogonadism, ejaculate volume can decrease dramatically, sometimes leading to complete dry ejaculation. Causes include aging, obesity, sleep apnea, certain medications, pituitary gland tumor, anabolic steroid use. Other symptoms may include chronic fatigue, low libido, erectile difficulties, mood changes, irritability, depression, loss of muscle mass, increased belly fat. A simple blood test can confirm or rule this out. Cause 40. Neurological complications. Your nervous system controls every aspect of sexual function, including ejaculation. If the nerves are damaged, the signal chain breaks down. Common causes include diabetes, poorly controlled over time, multiple sclerosis, spinal cord injuries, Parkinson's disease, stroke. In diabetes especially, controlling blood sugar is key to slowing or preventing nerve damage. Cause PI-FI, side effects of medications and treatments. Many everyday medications can interfere with ejaculation, yet patients are rarely warned. Examples include antidepressants, SSRIs, prostate medications, some blood pressure drugs, certain antihistamines, psychiatric medications, medical treatments like chemotherapy, pelvic radiation, and certain surgeries can also affect ejaculation temporarily or permanently. Important: never stop a medication on your own. Discuss alternatives or dose adjustments with your doctor. When to see a doctor: although dry ejaculation is often benign, seek medical help if it appears suddenly without clear cause, it's accompanied by pelvic pain, blood in urine or semen, loss of genital sensation, urinary problems, you're trying to conceive and can't ejaculate. Diagnosis usually starts with detailed medical history, symptoms, meds, surgery, urine analysis after orgasm to check for sperm, retrograde ejaculation, hormone testing, testosterone, and others. Imaging, transrectal ultrasound, neurological evaluations if nerve damage suspected. Treatment options: treatment depends on the cause, retrograde ejaculation, medication, related, switching to alternative meds may help. Post-surgery retrograde ejaculation: some drugs can strengthen the bladder neck muscle, but effectiveness varies. For fertility, sperm can be retrieved from urine or testicles for assisted reproduction. Blockages: long-term antibiotics, endoscopic procedures, or cyst drainage. Low testosterone: testosterone replacement therapies, injections, gels, patches, implants. No T may affect fertility, so alternatives like gonadotropins or clomiphene may be considered for men wanting children. Neurological issues: focus on managing the underlying condition, e.g., diabetes control. Psychological impact: experiencing dry ejaculation can affect self-esteem and sexual confidence. It's normal to feel anxious, worried, even ashamed. But remember, this does not define your masculinity or worth. It's simply a medical condition, like any other, that deserves attention. Ejaculation is more common than you think. Causes range from medications to hormonal, neurological, or structural issues. But in most cases, it's treatable. Don't let shame or fear stop you from seeking help. Your sexual health is a vital part of your overall well-being. If you've experienced these symptoms, schedule a visit with a urologist. Bring notes about your symptoms, meds, and changes you've noticed. Every case is unique, so the right treatment for you will depend on your specific situation. Remember, this condition does not define your masculinity, knowledge, and treatment. It can be managed effectively. Your sexual well-being matters and deserves professional attention. If this content helped you, please subscribe for more videos on men's health and overall wellness. Leave your questions in the comments. Your participation helps us create more useful content. And share this video with other men who could benefit. Together, we can break the silence around men's sexual health. Check out our other videos on erectile health, prostate care, and hormone balance. Links are in the description. Thanks for joining us for this important topic. Take care of your sexual health. It's part of your total health. Have an excellent day, and see you in the next video.